Hi there, my name is Anil Mani. I'm a cardiac and peripheral interventionalist. Today I will be demonstrating the use of a single indeflator for simultaneous dual balloon or stent inflations. Bifurcation PCI skills are an essential part of the repertoire of a coronary interventionalist. I frequently observe interventionalists utilizing two operators with two separate indeflators for simultaneous dual balloon or stent inflations, otherwise referred to as kissing balloons or stents. This requires quite precise inflation and deflation between the two operators, and I would dare say it diminishes the use of kissing balloons or stents. Ex vivo studies have clearly demonstrated the occurrence of stent distortion during dilation through stent struts, especially on the contralateral wall of the stent, frequently not visible angiographically. The likelihood of this distortion increases with the diameter of the side branch balloon utilized, usually greater than 2.0 millimeters. This increases the likelihood of adverse events from malapose stents, which is to be avoided. Finishing with a kiss is always a good habit. The use of a single indeflator will simplify this technique, do away with the need for two operators, provide true simultaneous inflations and deflations, with the ability to vary pressures on both stents or balloons as needed by lesion characteristics. First, begin with the indeflator filled with the appropriate contrast mixture. Take a three-way stopcock. This has 3 ports, an entry, an exit, and a side port. It has a knob. The knob should have a sealed back side. This allows adequate pressure handling. Take a male tubing. That's a high pressure tubing which has 2 male ports. It should be between 12 and 24 inches in length. Connect the end of the side port to the male tubing. Now connect the entry port of the stopcock to the indeflator. By turning the knob to the exit port, you now have entry into the side port. Fill this limb with contrast. The setup is complete. Now break the stopcock to the side which has no port. This allows a 3-way direction of flow from the indeflator into the side port and into the exit port. Position your stents or balloons in the coronary anatomy as suitable. Connect the side port of the stent or balloon to one of the balloons, say balloon 2. Connect the exit port to the other. Now, when you inflate, you will get simultaneous inflations of balloons to the appropriate pressure required, both being at the same pressure. To vary the pressure on one balloon, simply turn your stopcock closed to the one you do not want to increase the pressure on. Further inflations in pressure can now be performed on the other balloon, going up to say 16 atmospheres. Prior to deflation, reduce the pressure back to the original pressure in both balloons. Turn your stopcock back to allow both ports to be open and simultaneously deflate. This allows simultaneous deflation at the same pressure. It is important to remember that prior to disconnecting your balloons, deflate the indeflator. Then only remove the balloons or stents. This allows maintaining the integrity of the system if you need to use it again. This technique has other utilizations as well. Coronary interventions on chronic total occlusions frequently require simultaneous dye injections on two separate coronary arteries to allow adequate reconstruction, such as an occluded RCA collateralized by the LAD. Frequently, this is performed with two separate injectors. By utilizing the three-way stopcock with the attached male-male tubing, simultaneous dual coronary angiograms can be performed with a single injector. Connect the entry port of the three-way stopcock to the injector. Connect the exit port to the two-way via tubing to the main intervening guide. Attach a second three-way stopcock to the side port to allow flushing and medication administration if utilizing a motorized injector. The side port via the male-male tubing is now connected to the second catheter with an intervening two-way or a rotating hemostatic valve. By opening both ports, simultaneous angiograms of both arteries can be obtained. A turn of the knob also allows retrograde visualization alone during intervention. Another utility of the three-way stopcock is the ability to perform gradient measurements during peripheral angiography without repeated catheter engagement and withdrawal across a lesion. The side port here is connected to the sheath with the main port attached to the catheter placed across the lesion. The sheath has to be 1 French larger than the catheter for adequate pressure measurements. By turning the knob, the two separate pressures are obtained in continuity, obviating the need for a pullback gradient that might require repeated engagement through a lesion if capture fails initially. Turning the knob to allow pressure measurements across the lesion and then turning it immediately to the sheath will capture the gradient adequately. Thank you for listening. I hope this has been useful. We'll see you shortly again. Bye-bye.